Hi, I'm Dr. Kelly Starrett from the Ready State. One of the reasons we love to use H-wave in surgical situations is it allows us to skip over this whole neuromuscular inhibition. If you've ever heard someone have knee surgery, for example, they'll often talk about the fact that they have a real hard time recruiting their quadriceps. In fact, a lot of the post-surgical sort of response from physical therapists and rehab after knee surgery is just keeping the knee sort of re-plugged into the brain. How do we reestablish this neuromuscular control? We have a whole bunch of exercises, active straight leg raise and quad pumps, and we're just trying to keep that knee musculature from being inhibited from the trauma around the knee. Well, guess what? Oftentimes when we use H-wave, we don't have this problem. We just skip right over. In fact, the faster we can get the H-wave on the affected limb, the earlier we can get this sort of motor recruitment, neuromuscular connection bridge reestablished, which is amazing. One of the things that happens is just by getting this non-fatiguing muscle contraction right away is that we reestablish this connection to the brain. We're getting 2 pumps a minute, and the brain says, oh, I know how to recruit that. Additionally, even when people are numb, we can still be actually practicing firing the quadriceps when the move is pumping or when the leg is pumping. So what ends up happening is that I'm getting 2 pumps a second, that's 2 hertz, and I can do a quad set with each one of those. So I can kind of use it to jumpstart the system. The H-wave is actually FDA cleared for neuromuscular rehabilitation. But we often find that we don't have to even use it for those things if we can have early enough intervention where we can keep that connection alive. And literally, one of the things that happens is that my athletes come out of surgery and they're like, I didn't even have a knee problem. I didn't have extensor lag. I was able to maintain my quads. And that puts things on like disuse atrophy off the table, which means that disuse atrophy means if I don't use the muscle and I'm disconnected for a week or so, I oftentimes can start to eject and lose some of the structural proteins of that leg, which means that it's harder to reestablish control, it's harder to keep the mass on, harder to keep that strength. We want to nourish and keep that engaged as much as we can, and we do that through early activation. And that early activation means I just put on the pads and start pumping away. It's very, very easy. It's low sort of invasiveness. And even if we're seeing a leg that's highly bandaged, we just move the pads around until we get a solid contraction in some aspect of that leg. And oftentimes we're able to find enough real estate where I can still get a massive contraction without having to kind of disrupt the need to keep the area sterile clean. The bottom line is, we think that an H-wave is a fast track to expedited healing. Because remember, you're either going to heal at the rate of a human being or heal slower than that. There's no such thing as a fast healer. But if you use an H-wave, your friends are going to think you are a Wolverine.